Hello, and thank you for joining us for this American Journal of Managed Care's Peer Exchange. In the United States, more than 11 million people have some form of age-related macular degeneration, and this can lead to loss of vision. There are two forms of the disease, wet AMD and dry AMD. In wet AMD, vision loss can be rapid and severe. This AJMC Peer Exchange panel of experts in ophthalmology and managed care are going to discuss the diagnosis of AMD, therapeutic options available, and patient access to therapy. I'm Dr. Peter Salgo. I'm a professor of medicine and anesthesiology at Columbia University College of Physicians and Surgeons, and I'm an associate director of surgical intensive care at New York Presbyterian Hospital. Joining this distinguished panel to share their perspectives are Dr. Peter L, medical director of medical management at Blue Cross Blue Shield of Minnesota in Eagan, Minnesota. Dr. Gary L. Johnson, practicing physician and medical director in Madison, Wisconsin. Dr. Jared Nielsen, vitreoretinal diseases and surgery at Wolf Eye Clinic in West Des Moines, Iowa. And Dr. Charles Wykoff, director of clinical research for Retina Consultants of Houston and deputy chair for ophthalmology at Blanton Eye Institute, Houston Methodist Hospital in Houston, Texas. Gentlemen, you all are gentlemen, thank you for joining us, and thank you too. Why don't we get right to work? Let's get some definitions settled right away. Age-related macular degeneration, AMD. What is it? How common is it?
Well, macular degeneration is the most common blinding disorder among patients over 55 in the United States. And it has a huge impact for patients who suffer from that disease. As you can imagine, patients who suffer with loss of the central vision can't drive, can't do many of the things that they like to do, and it really affects their quality of life. Unfortunately, the person who suffers from AMD isn't the only solitary victim of this disease. It affects caregivers and families who then have to step in and help somebody who's lost their independence and ability to take care of themselves.
I mean, it sounds almost self-serving to say that caregivers are affected, but when you're dealing with somebody with this kind of illness, I mean, that everybody's in the same boat here. I mean, clearly somebody's losing vision, but somebody's caring for that person, no?
Absolutely. It can affect the entire family. It can be a devastating process.
Now, I'm interested in the number that you quoted, because diabetes, huge problem in the United States. You're telling me that AMD is distinct from that, and there's more?
Well, you know, diabetes is the most common blindness disorder of working age adults in the United States. But once you get over 55, then AMD takes over as the most common blinding disorder in the United States.
So it's a massive problem. And I'm not sure, by the way, that a lot of primary care docs are aware of that.
Yeah, I think it does not have the same recognition outside of ophthalmology that certainly we see on a daily basis with our patients. And by the 2050, they estimate that there'll be 80 million people worldwide that are affected by this disorder, and that's staggering.
The way I like to frame it for my patients' families is, if you take all causes of blindness in our country, AMD causes more blindness than everything else combined.
Everything else combined?
It's the big player if you look at all ages combined.
Again, I think that comes as news to all practitioners combined. Maybe not to ophthalmologists or retinal specialists, maybe not to payers, but to the average private physician out there, primary care. I don't think that's really made an impact. Do you see that?
I think unfortunately for decades it's been accepted that people are going to get older, their hair is going to turn gray, and they're going to go blind. There's certainly many cultures around the world where that's the case, often due to cataract, but in our country, the most common cause of blindness as we get older is not cataract, it's macular degeneration.
Okay.
In fact, 12% of people over the age of 80 have macular degeneration. So as you're walking around in your community, 1 out of every 10 or more individuals is going to be suffering from that disease if they're 80 or older.
Again, I don't want to pound this into the ground, but 10% is an enormous amount of folks, right?
Are there more things that can be done at the primary care level?
That's a very good question. I think it's challenging sometimes for primary care physicians to have the tools to figure out what sort of disease their patients may be suffering from. Certainly there are valiant efforts from a telemedicine screening, and Charlie and I are both involved in some of those projects to try and bring some of those technologies into primary care. But really, it takes some of the skill and expertise to make that type of diagnosis, and also to help people navigate it as they have that disease.
I think the two places where primary care could be involved are the associated problems. So we know that when older people especially lose vision, there's two big things that go up. Mental illness, which I don't think is screened for enough in the ophthalmology community, and also instability, so fall risk. Both of those things need to be managed more broadly among the poor sighted, especially from a primary care perspective.